Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today we welcome back on the show Jillian Reigert. She is an oral medicine specialist and radiation oncology research fellow. Her latest article is Military and Medicine, 10 Shared Risk Factors for Eating Disorder Development. Jillian, always great to see you again.
Yes, thank you so much for having me back, Kevin. I love everything that you're doing, and I appreciate you having me back on the show.
Yes, and for those who haven't listened to our first few episodes together, I highly encourage all of you to seek them out because they're all wonderful. So today I am actually going to jump straight into your latest article, Military and Medicine, 10 Shared Risk Factors for Eating Disorder Development. Jillian, for those who didn't get a chance to read that article, just briefly share the story why you decided to write it and walk my audience through it.
Yeah, I decided to write the article because if you go back to our previous articles and our previous podcast opportunities together, part of my story is that I was a Air Force oral surgery resident. And during that time period, I developed pretty severe suicidal ideation. And to manage the symptoms of suicidal ideation and major depression, I numbed myself through eating disorder behaviors, which was anorexia. So I had the ability to observe the risk factors that were shared between military and medicine for the development of eating disorders at the time. I also had the ability to appreciate the gaps of knowledge that were both in the military and in medicine. And it was a very interesting point of view to understand that people, I think, are making eating disorders more complex, and they're making them, some anorexia seems to be glorified, or binge eating disorder and things where there's extreme weight biases are causing people a lot of shame, which is very disheartening to me. And I think we certainly need to increase our knowledge of eating disorders, our awareness. And then the third thing was that I also appreciated that there is a lack of evidence-based care models and treatment that is very effective for management of eating disorders. So I really wanted to get these conversations, I know they've been going a little bit, but to bring my lived experience to the conversations, invite people that have lived experience to share their voices, because eating disorders often lead people to be silent, especially when they're in systems where it's not understood, or people think they're too complex, so they keep referring, and that's doing a major disservice to many.
So you wrote in your article that there are risk factors within the military and medical culture that create perfect storms for developing an eating disorder. So tell me what some of those risk factors are.
Yeah, if we think of eating disorders and what their role are for an individual, what I think they are coping skills. And for me, there were coping skills. Anorexia came when I was having overwhelming emotions. I was feeling inadequate, and it helped to numb me from the pain of feeling inadequate. When I developed suicidal ideation and lost my appetite and didn't think I was worth living, then anorexia became kind of a passive suicide. And so it's really understanding the role of an eating disorder in a person, and then who's at risk for using that tool as a way to help them cope, or what creates a circumstance that might put somebody in a need for such a relief from the pain they're experiencing. And I often equate anorexia and eating disorders to like an addiction, so that if people can't understand or think that eating disorders are too complex, they might equate it to somebody that's dealing with an addiction. So the risk factors that I identified, of course, there's more. And I also want to say, my initial training was in dentistry. This is applicable to dentistry. It's applicable to nursing. It's applicable to being a lawyer. It's applicable to being a teacher. I'm sure it's applicable to many different professions. The reason why it's written on medicine and military are because this is where I was at, and this is what I'm currently in my healing journey from. So that's the perspective that I bring, and of course, translate it to how it applies to wherever the listeners are and what career that they're in. So the risk factors were individual predisposition. Often we think type A personalities, high achievers that might feel that need to be perfect, which comes in as another risk factor, that strive for perfection, never feeling good enough. So you might use an eating disorder to cope with that and feel that, if I think about especially our weight bias and diet culture, if I eat less and exercise more, I'll feel more valuable. And it's an illusion of increasing your value from being able to do those things. And then the next thing was the inability or the reduced ability to express our emotions. So if we think of eating disorders as a coping skill to really numb ourselves or to feel better because the emotional experience or the physical trauma that we're having is very painful, then we might use eating disorder behaviors, whether it's restriction of food, eating food, or doing anything that are eating disorder behaviors to help give relief for whatever that other experience is. And then we talk a lot about moral injury and trauma. That's another thing that brings a lot of pain for a person emotionally, spiritually, physically. And so eating disorder behaviors can come as a way to help that person cope with that experience. The weight bias is something I'd really like to focus on, because the weight bias is in the military. You have to meet weight standards in order to stay in the military, which causes people to do extreme things before they get weighed. And that hyper focus on how poor that is on a person's mental and physical health is not really discussed. And then when I developed anorexia, I just felt inadequate support, inadequate understanding. And so people that are in the military that are facing these weight biases and are in a culture where weight is highly emphasized, they are at higher risk for developing eating disorders as a known entity. If you look at articles coming out about the military, and then they don't feel like they're able to speak out because of fear of losing their career. We translate that to medicine, where we're constantly harping our patients on their weight. How does that affect us as the physicians? Because we keep hearing our own messages. We are inundated with messages that people should strive to lose weight. How does it make us feel? And really, is it necessary? Like, what's the true evidence behind these weight stigmas? And then our delivery to patients about their weight. Something that just happened to me is in the past year, and why I started speaking up about my eating disorder is last year I almost lost my life to anorexia. And so I was very medically compromised. So over this past year, I've gained quite a bit of weight, which is a very good thing. But I went to a primary care physician, and I was concerned about heart failure symptoms. And I started the conversation with the heart failure symptoms and gave the symptoms that I was having. Of course, with a background in medicine, I knew what those symptoms were with an understanding I was at risk because of anorexia. I was very nervous. She immediately grabbed onto the weight number that I provided as my weight gain and started counseling me on weight management. This was a televisit, thankfully, because I felt physically safe, but I was just so appalled because I was like, oh my gosh, this person knows, she can see all my medical records. I'm, ex-military. We have shared medical systems no matter where we're at. I told her, in order to preserve myself from hearing this weight shaming educational opportunity for her, like, yes, I'm recovering from anorexia, where I almost lost my life last year. And it was like a moment of celebration, right? That, yes, I gained this weight, and I have an article on your platform is I regained weight and I regained my life. And in the moment, all she could think about was, oh my gosh, we really need to extinguish this fire of weight gain. I called for symptoms of cardiac failure, and then I had to advocate for myself. I'm currently mid cardiac workup, and I'm feeling better, thankfully. But people are getting weight shamed all the time. You hear it all the time. Like, they came in for an asthma attack, they're immediately weight shamed. They came in for something medical. It's likely that society's been reminding them of their weight all the time, and they're shamed for their weight, and their medical workup maybe delayed or not even performed. So we're being blinded by our weight stigma. And so for people in the military and medicine, where we have all this weight stigma, if a person has an eating disorder where then they're coping because food makes them feel better, well, then we're increasing their weight and we're actually contributing to the weight problem. Or we're contributing to more eating disorders that are restrictive, no matter what the weight, in order to prevent people from feeling the pain of this weight bias. So that number 4, we could talk about for years. So that's such a component of our system that really needs to be changed. But I'll go quickly through the other ones because they're very similar in the fact that the eating disorder shows up as a coping skill. So in medicine and military, we have decreased autonomy. So for feelings of control, we may gravitate towards feeling control of food, our body, exercise. in the form of eating disorder behaviors. It shows up with our constant transitions. In medicine, we go from rotation to rotation, where we go from education to career, or career to a new job, or a new job to then you're married and you have kids, and there's constant transitions that you're trying to navigate. And then if we have comorbid medical or mental health conditions, such as, we're hearing a lot more about suicidal ideation, as I mentioned, and depression. And if I need to relieve myself from the darkness of depression or anxiety, it's tangible for me to focus on food and running. And what it does is it just numbs me out completely. But if you're numb, you're numbing yourself both from the positive and the negative emotions. So you just kind of become a shell of a person. And then, of course, the misconceptions that I mentioned, why we wanted to bring this to the attention. And, of course, this is so robust of a conversation that we could talk about for a long time. And I invite that, not only for my voice, but for the voice of all that have knowledge and awareness on eating disorders and how this affects them in their life, so that we could really start to break down appropriate next steps in people's healing. And then the mental health stigma. So something that always comes to mind when we think of medicine and military is, can I ask for help without fear of blank? Fear of losing my career. And that was my top fear. And fear of licensure was another fear. And I waited until the question was, if I don't get help, I'm going to lose my life. And I mentioned to you, it wasn't clear to me at that time whether or not I would get help, because I'm like, well, if I leave, I thought my life was pretty much over. So we need to stop putting that pressure on people. It's not true. It's not true. And your life is far more valuable than your career, because without your life, your career won't be there. And the world needs you. So it's really important to continue these discussions.
Now, let's say if I'm a clinician listening to this podcast or reading your article, and they realize that some of these risk factors that you mentioned applies to them. What are some of their next steps that they should do?
Yeah, the risk factors, if they're noticing, weight stigma is everywhere. And it's just noticing where they're getting their messages and how it's affecting them on their daily lives. And also just noticing what the role of an eating disorder could be if we name it. So if I say, oh, well, I have eating disorder thoughts all the time. And if I name the role that they have in my day-to-day life, it's like, oh yeah, I'm feeling pretty inadequate today. Well, then I'm going to dive inward and say, how can I find purpose and value in my life without relying on this coping skill to numb me?
Now, over the last few articles, you've been very, very open about your past with eating disorders. In general, what has the response been?
I feel like people understand more of eating disorders that might be binge eating disorder and have a relationship of food that brings them comfort. I have gotten some private messages by people who have lost their children from anorexia. I have felt that that's a smaller group of individuals that have reached out to me. But I do think it's because anorexia it's kind of glorified, and especially if it's something that people hold on a pedestal, there's a lack of understanding. And people often say, I wish that I had the emotional response to food, that when I was feeling this way, I wouldn't eat. And so it really highlights the fact that people don't understand the heck it is to live with anorexia. So I did create a video on my new YouTube channel that you were we were talking about before this conversation, and it's demystifying and deglorifying anorexia nervosa, so that people can really start to understand what it's like to live with anorexia, and then the people that are affected by it themselves or have loved ones can really start to understand what it is, because Hollywood's done a really strong disservice, and even our medical education that keeps promoting the stereotypical. I know I'm a Caucasian female, so I do fit the mold of a stereotypical person with anorexia. However, as I mentioned, the role of anorexia was to numb me from my own insecurities and feeling like I wasn't worth living. It wasn't because I wanted to be some supermodel. So it's trying to break those stereotypes. So of course, I think anybody that's going to converse with me and ask me questions, I welcome that. And if there's any sort of thing that triggers me, well, then that just reinforces I have more work to do on myself. And then if someone weight shames me, or one of my biggest fears for advocating for anorexia was like, I'm no longer severely malnourished. Like, do I have to prove to them that I was that sick? Because that happens a lot where people show the before and after, which feels like they're validating that they were super sick, which actually does a disservice for people in bodies that look healthy but are struggling with restricted eating disorders. So I thought if someone were to actually comment on my body, what it took me to actually lean in to just keep talking was I have so much self-compassion for my body after the trauma that I put it through. Mm-hmm. They can say whatever they want, and it's more of a reflection of their own internal biases, their own internal struggles, and I can help support them, not for them. But I use my voice for me. I use my voice for the people that will use their voice eventually, but maybe need a kickstart and a little bit of support. So I think the overall message is just to keep using your voice. People will say things all the time. And anorexia showed up for me when I didn't know how to speak. I turn everything inward. And so the more I speak and just keep speaking and letting it out, I think the more it is healing and providing the connections that help support healing for others.
We're talking to Jillian Reigert. Her latest article is Military and Medicine, 10 Shared Risk Factors for Eating Disorder Development. Jillian, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, I'm a huge Martha Beck fan. So I have many Martha Beck quotes that are huge takeaways for me. But we talked about naming it, like naming the role of eating disorder, or naming whatever the thing is that person's struggling with. So I have one of her quotes. It says, so this is Martha Beck quote, "True freedom starts with absolute honesty. The moment you call a problem by its real name, you're already learning how to make it less harmful." So Martha Beck, love her very much. If you're in a career life transition and navigating who am I without the labels, then The Way of Integrity is the book I highly recommend.
Jillian, thanks again for coming back on the show, sharing your time and insight.
Thank you so much for having me, Kevin. Appreciate you.